we'll start with development anomalies, size and shape. First we'll discuss about the microdontia. Microdontia, micro means small. So microdontia is disturbances in tooth size. Microdontia is a dental condition in which teeth are smaller than the normal. It can be classified as true microdontia and relative microdontia. Now what is true microdontia? In which actually the tooth size is smaller, and in relative microdontia, it is a generalized microdontia. All teeth are small but the jaws are large, making the teeth appear to be smaller. What can be the causes of true microdontia or generalized microdontia? In generalized microdontia, all teeth are smaller than the usual teeth. Causes can be this is often hereditary. Microdontia involving a single tooth can also be there. Description: single tooth is significantly smaller as compared to the other tooth in the jaw. Typically affected tooth is the maxillary lateral incisor. Often it is seen as peg laterals. It is a cone shaped appearance where the sides of the tooth appear tapered. These teeth are also tend to have shorter roots. Okay, so microdontia can be true microdontia and relative microdontia. True microdontia in which the teeth are actually small. In relative microdontia, because the jaw size is bigger, so your teeth appears to be smaller. And most commonly seen are the peg laterals, in which peg laterals or maxillary lateral incisors are usually the ones which you can see microdontia to be. Next is the macrodontia. Macro means bigger size, or it is also known as megalodontia or megadontia. It is disturbances in the shape of the teeth. Macrodontia larger than the tooth is larger than the normal tooth. Examples can be seen in pituitary gigantism or otodental syndrome or XYY syndrome, which is also known as Jacob syndrome. Now what is otodental syndrome? Otodental means auto means hearing and dental, both are involved. Okay, relative generalized large teeth plus small jaw can be relative generalized teeth, hereditary. And okay, so these are the basically on the basis of size we can differentiate into microdontia and megalodontia. Next, on the basis of shape and size, we often classify teeth to be under gemination. What is gemination? Gemination is defined as a single enlarged tooth. Gemination is defined as single enlarged tooth or joint that is double tooth, in which the tooth count is normal when the anomalous tooth is counted as 1. The single tooth jump divides and forms two incomplete tooth. 2 crowns and 1 root is called as gemination. You can see this is gemination. Here 2 crowns but the root is 1 root. Okay, so this is gemination. 2 crowns but the root will be 1. Okay, now bilateral gemination, 2 double teeth are usually present. In gemination, the tooth are joined to at the crown as well as at the root level. What is twinning? Twinning is also a form of gemination in which complete gemination, that is one extra tooth in the arch is present, is called as twinning. Has sometimes used as a designated the production of equivalent structures by division resulting in more than one normal and one supernumerary teeth. So one normal tooth plus one supernumerary tooth, that is 2 crowns plus 1 root. Gemination is usually n plus 1. Okay, now the next is the fusion. Fusion is defined as a single enlarged tooth or joint that is double tooth, in which the tooth count reveals a missing tooth when the anomalous tooth is counted as 1. So fusion is usually n minus 1. It is more common in primary dentition, remember this. Root canals may be separate or may be fused. When fusion occurs before calcification, two teeth are completely united. If it occurs after calcification, only roots are united. So you can see here, fusion is usually n-1. In fusion is more common in the primary tooth. The root canals are separated or may be fused. Okay, so here you can see there are missing teeth are present, and you will see there is a the crowns are two, but the root is single, and there is n-1 total count. The number of tooth will be less in case of fusion, where in gemination or in twinning the total count of tooth will be more. This is the example of gemination. See here, it is joined at the level of root as well as at the level of crown, and as you will count, it is n+1. More number of teeth will be present. This is fusion and this is gemination.